My name is Gary Edward Mols. I'm 66 years old, and I live in Annapolis, Maryland. I was diagnosed with prostate cancer in early 2019. Prior to my diagnosis with prostate cancer, life was very enjoyable. My significant other, Dee Dee, and I were living a very normal life, doing a lot of traveling, and we were both looking forward to retirement. Every time I visit my primary care physician, he always takes my PSA, and it went up in a short period of time. My urologist started explaining to me about how PSAs can go up as you get older. And then he did an examination, and then immediately when he did the examination, he says, "You need to get a biopsy." I had the biopsy, and a couple days afterwards, I got a call from the urologist, and he told me I had prostate cancer with a Gleason score of 7. The first thing that went through my mind was, oh my God, I have prostate cancer. I need to start investigating what my options are. I visited probably 3 urologists and 2 oncologists before I made the decision on what the proper treatment plan was for me. We had done some research on CyberKnife, and we saw the closest place with CyberKnife was MedStar. So we made an appointment to see Dr. Perry, and he spent probably an hour with us going over the treatments and discussing what my options were at MedStar. When we met with Dr. Perry, he was very personable, made me feel like a part of the family, and he was very good at explaining my treatment options, especially with respect to CyberKnife. The treatments turned out to be 5, and they were 2 days apart. And so within a week and a half, I was completed with all my treatments. During the days on which I had the treatment, I actually went to work at the beginning of the day. And then if I felt fine after the treatment, I would go back to work. And in most cases, I was able to go back to work. Very few side effects with respect to the treatment. After the treatment, for an extended period of time, you need to monitor your PSA, and it did go down, and that's exactly what was planned. We could see that the PSA was continuing to go down to very low levels, and that's when I started feeling very good about how effective the CyberKnife treatment was.
Today, Gary is in good health, and I'm very happy about that and very relieved.
To Dr. Perry, I would say thank you. Thank you for the openness and the education that I received with respect to the treatments being considered for my prostate cancer. And I think we've cured it. Thank you.